You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Dr. Jonathan Baktari, who is the CEO of E7 Health and the U.S. Drug Test Centers. Welcome to the show.
Oh, thank you so much for having me. I'm very excited, Roxy.
It is so good to have you here. So let's just start off like I do every episode. Tell our audience a little bit about your background and what you've been innovating these days.
Yeah, so my background is actually pretty traditional, in terms of doctors, pre-med, went straight into medical school, residency, fellowship, and came out and practiced. And so in that sense, I was a straight arrow, kind of just did everything by the book from high school, college, med school, residency. And then, once I became practicing and, board certified and was a partner in a group. And I was teaching in a medical school, and slowly other opportunities presented itself, in terms of administrative stuff, being on committees, getting involved in leadership. And I think out of that, one door kind of opened another door, as it were, in administration and leadership. I guess there are not that many people wanting to volunteer extra time to kind of get involved in some of that stuff, especially physicians are busy. But for me, it was an opportunity to kind of expand my horizons, because there's no more fellowships, residencies. So, you kind of think, what's next in terms of how do I grow?
Yeah.
And so I started doing that, and just literally one door would open up another. I was like, sign up to be on a committee, and on that, I was on that committee, and then someone said, well, could you do that? And could you be involved in that? And next thing you knew, I was, medical director of, state medical director for Blue Cross Blue Shield. And I was medical director for the Culinary Health Fund, which is a big healthcare self-insured group here in Nevada. And then, I was chief of medicine at the Department of Medicine in one of the hospitals, and the ICU director at another hospital. Anyway, so it just kind of snowball. And then I realized, with the experience that I had clinically and teaching, as well as this administrative stuff, then, I was also a hospital administrator, being more on the hospital side. And so you just get this perspective on healthcare, because you're seeing it from the eyes of, the people out there who are practicing clinical medicine. Then you see it from the teaching perspective of residents and interns and medical students. And then you see it from the hospital side, what the hospitals are thinking, what they're going through. And then you see it from the insurer side, literally, all the players. And that gives you a window into how to do things and how not to do things. So eventually an opportunity came up to create E7 Health, which was called the Vaccine Center back then. It just felt like a fun thing to do. And initially, I don't know how serious we were, but I think we were. But it just kind of evolved. And then out of that came U.S. Drug Test Centers, and how we grew that. So I think I tell my colleagues, whoever asks me, who are still practicing clinical medicine, it's not a wake up one morning and you're the CEO. It's more of you got to get on committees, you got to get involved in the non-clinical side, whether it's inside your group, inside your hospital, and then see if you like it, first of all, and also just be on the lookout. I think people kind of knew that I like that kind of stuff. So literally someone would just say, hey, I heard that they're looking for someone over there. I was at a meeting and I heard that this is, and then so let me connect you to.
Yep.
So if people know you have an interest in it, they'll help you. So that's really in a roundabout way what happened.
So what was it like for you, physician, administrator, medical director turned entrepreneur? What was that like for you, that transition like for you in the beginning?
Yeah. Well, it was I'm gonna put down doctors a little bit. We always kind of think, we're the smartest guy in the room, which we're not, of course. We're never.
No.
No, yeah. And I don't know if I had that, but you kind of figure, well, listen, if I made it through organic chemistry and physics and anatomy, wait, I can't figure this out. And so,
Yeah.
no, but the one good thing that I had that I think really helped me as,
Mhm.
being in training for so long. I've been in training my whole life, from pre-med to med student to resident to fellow. And even when I was a partner, I was a junior partner. So I am really good at knowing that I don't know what I don't know. And I just shut up and listen. And it's, I now mentor it as coachability.
Mhm. Yes,
Yeah.
yes.
Okay. Are you
Yep.
coachable?
Hmm.
And I think the one thing, my journey of always being underneath someone else. People don't think, oh, this guy that's doctor's on top. No, no, no. Doctors spend most of their lives on the bottom. When you're a medical student, you're not talking back to your intern. And when
Yep.
you're an intern, you're not talking back to your resident. When you're a resident, you're not talking back to the fellow. And when you're the fellow, you're not talking back to the attending. And when you're a partner, you're not you're talking back to the senior partner. So you're always growing and listening. And I think that is the biggest asset that a CEO can have. Shut up and listen. Listen to
Entrepreneurship. Yeah.
listen to what people are telling you. Just shut up and, obviously seek out the right people, but then shut up. I mean, just like what is it, what is it that you can gain from them so you won't have to make these mistakes?
Absolutely. Yep. No, listen to all those other people that already learned those hard lessons. So we don't have to do that on our own.
Mhm.
Huge fan of that. So you started a company, E7 Health. You
Mhm.
spin off a second company into that. Tell us, what has this commercialization journey been like? I know that you have been able to ride some pretty amazing tailwinds. So
Mhm.
talk about that a little bit.
Yeah, I mean, I think what we realized back in 2009, so now a long time ago, is that, there was aspect of preventive healthcare that nobody was really addressing, and that was adult vaccinations. Again, nobody thought of that pre-COVID, but it was a big thing because, this per the CDC, I think I told you earlier, there's about 50,000 vaccine preventable deaths annually in the United States, a
Yep.
lot. And just so understanding that, and then understanding, well, how can we actually get into the market? Because what we realize is, your local doctor, your local primary care doctor, had been moving away from giving adult vaccinations. So it used to be in the old days, maybe 30 years ago, you could probably get a tetanus shot and maybe even a hepatitis B shot as an adult and a flu shot from your primary care doctor. For reasons probably that have to do with reimbursements, doctors have gotten away. And that's how really Walgreens and CVS stepped into the picture.
Yep.
If all the doctors had it, they wouldn't be in the flu shot business, right?
Mhm.
Right. So but that wasn't enough. I mean, the point of, you need to have an easy way to get to your vaccines. As much as I love Walgreens and CVS, giving adult vaccination is not necessarily their only focus. They're also selling diapers and Frito-Lays, and they're doing a lot of stuff.
Yep.
Okay, so we thought, well, wouldn't it be cool if we came up with a focus to make a dent in adult vaccination, but also right technology to facilitate it. So we slowly evolved into a technology company. And honestly, I joke around, we're really a technology company masquerading as a healthcare company. But yeah, so then we married the two, and we came up with an innovative way to address it by not doing other stuff. Part of, I think, a lot of what we do, maybe other people do in parts, but they also focus on other stuff. They're doing primary care, they're doing urgent care, they're doing workman's comp, and they're doing all these things. So this doesn't become their focus and bread and butter, right? So we just thought, if we just focused on this, and somebody comes in with a sore throat to our office, we're just going to refer them somewhere else. We're not going to see them.
Mhm.
And that was very tough. I think most people who do what we do, they're like, well, listen, you're already set up. You got doctors or nurses, and then somebody comes in with a sore throat, just see them. They're like, nope, we're not going to see them. And that was innovative in the sense that we're probably the first, I don't know of any other clinic in the US that, has, you'd walk into our office and it looks like, we could see those people. And it would be very tempting to say, oh, well, why turn those people away? But we just thought that our staff's focus and mission would be diluted. Sort of like when you see primary care doctors who are now doing Botox and diet pills and weight loss, you're like, whoa, wait. So like, what's going on? And so, you can't be an expert on everything. And we want to hold ourselves out as the 900-pound gorilla on adult vaccinations and everything related to it. And so we it was very and no, everyone told me not to do that, not to exclude primary, because it's such a, everyone, primary care is something that, it's just easy to do. And if you have all the facilities and equipment and staff, why not? So anyway, I think that was one of the decision points.
So what is your business model? What is the problem that you solve, and who's your paying customer?
So what we found is the services we provide, we have B2B and we have B2C. So the B2B, those clients often have hired, 4 or 5 other companies to do what we do. For example, there are companies that have a flu shot company that comes and gives their, staff flu shots. They have a company that does their drug testing. They have another company that if they need yearly physicals as part of the labor that they do, they have another, clinic or doctor that does that. Clinics, I know. So for a lot of jobs, you need vaccinations, to even often to be a security guard, you need to get a hepatitis B vaccine or before you could actually start that, to get into healthcare, to work in a medical practice, to work in a dental practice. And also, there's defense firms that need deployment physicals, which involve vaccinations. And a lot of companies send their staff overseas to developing nations. All those people need travel vaccines. So companies need these services. And usually they're getting them from 4 or 5 places, and they don't have a centralized dashboard where everything they're getting from these 5 companies exists. Mm-hmm. So just their management of healthcare data, it is probably a multiple of what they're paying for the services.
Sure.
So in other words, and we provide that for free. We manage their employee health records and give them access to it in a cloud-based fashion. So not only are they getting, are they not going to 5 different companies, but we're serving up the data. We're probably the only clinic in the United States. I defy anybody to tell me if there's another one that doesn't have a medical records department. Mm-hmm. And the reason we don't have a medical records department is there's nothing we would have done for someone that's not on the cloud in their portal, in their individual portal and in their company's portal. So no one ever calls us says, I need my medical records for this and this. Oh, it's like Amazon. You wouldn't call Amazon and say, hey, what did I buy 6 months ago? Like, can you imagine like calling Amazon saying, hey, what did I buy 2 years ago? Can you tell me? So you say, well, why don't you log on and go down to your orders and see what you bought 2 years ago? Mm-hmm. You don't need to call Amazon. So that's what we thought of healthcare. You shouldn't have to, call anyone to get your records and even, just the whole clipboard thing. People, I've been on so many shows where people say, oh, healthcare technology has advanced and blah, blah, blah. Then why do they still give you a clipboard? I mean, both can't be true. Right. It can't be, what other field still gives you a clipboard when you walk in and tells you to fill out this paperwork?
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. I want to go back to this. So it sounds like you started off B2B.
Well, no, simultaneously, as long as we built this in a storefront.
Okay.
So if you were starting medical school or nursing school, or you were just applying and they want all these stuff, or you're starting a job, but they want you to provide all these services, or you're traveling. Let's say you and your husband decide to go on a safari, to Kenya, and you're going to need all these vaccines. So no, I would say that's one of the things we decided to do. We weren't buried in a medical building on the 4th floor in the back. We literally went into a shopping center, right next to Great Clips and, Domino's. Right. And we just put a storefront there because and literally there's no parking lot. You just pull up to often right in front of our clinic. And so, I would say half of our business are students, people who are working, traveling, people who are trying to get a green card. They have to go through an extensive Homeland Security physical, which involves vaccines and laboratory testing. So whether you're trying to, become a U.S. citizen, whether you're traveling, whether you're trying to get a job, starting med school, residence, nobody was taking care of this population. They were just running around to 20 different places.
Yeah.
Mm-hmm. Okay. And nobody certainly was doing it with technology. I mean, we have literally 10,000 reviews on our website in the last 3 years. And all of that speaks to my staff, how great they are, and the technology we provide. I mean, literally, you could actually pull up to our storefront, book an appointment on your cell phone, walk in, and 10 minutes later leave with the service you wanted, and everything's on your phone.
So I want to get back to the business part of it. So then you decided you were going to go B2B and B2C at the same time, and also brick and mortar. Were you serving like a specific geographical location as opposed like a local?
Right. Mm-hmm. Yeah. What we decided to do is to take over one metropolitan area, which was Las Vegas. So, and given the size of Las Vegas, having 2 locations covers the city for the most part, just because it's. So the whole idea was to cover a city. And now if we were in, let's say, Chicago or LA, 2 stores wouldn't be enough to cover the whole city. But for Vegas, it worked out. And we really wanted this to be the prototype for other cities.
Mm-hmm. Yep. Okay.
But we wanted the right technology so we could scale it potentially to other cities. In other words, we spent all these years figuring out what would it take. So if we open up a store in Memphis, it would be scalable. Think about like McDonald's. Like when McDonald's opens up a new location, they send all the equipment, all the software, the training. They send you to McDonald's University, and you go and flip burgers for a week, metaphorically, and then you go start your McDonald's. So it was not that we would franchise, but it was just the concept that even if it was in-house, you need a scalable model that the software would, and also for staff that weren't right next to you. You're going to open a store 3,000 miles away. You have a home court advantage when you're there making sure everything. So we had to really develop technology that was scalable in a meaningful way at a place we weren't.
Yeah. So talk about that digital transformation.
Yeah. Well, I think for E7 Health, the issue really became, why is healthcare technology so bad? I think people think it's good, but until someone tells me, things like, why do you need a clipboard? And why don't you have access to every test you've ever had or every thing that's ever, it's not that good because Amazon is kicking our butt, right? Amazon software is killing us. I mean, I can find out anything I want about anything I've ever done with Amazon, and I'm using them as an example. So healthcare technology, just people think it's great, but it's not that great. And there's a reason why, and I can go into that. So we just said, you know what? Why don't we want to go head to head, and I want to pick on Amazon. I want our software to go head to head with Amazon. So, the technology you get when you deal with them. Okay, what is it that I mean, you could write them a letter, you could request a refund, you could pay online, you could whatever, and every feature that Amazon would have, we want to have, because why should healthcare be second fiddle?
Yep.
And so and so we've been writing and doing all that technology. So that was really the journey, to reduce friction for the patient, but also improve quality. It's interesting, medical errors occur all the time, and most of the time it's insignificant, but they occur anyway. And the question was, how do we provide better patient care? This doesn't necessarily improve your ROI, but as a professor in med schools and whatever, this was important to me. And so we spend a lot of time in our technology preventing errors. In other words, let's just say you hire a new staff and they're about to give a vaccine too early, too late, or they're about to, schedule the next appointment too far out, not far enough. So you can write all that into your technology that blocks people from doing the wrong thing, or alerts them, or doesn't let them move forward until they address something. And we spent a couple of years just pounding that with our developers and focusing on improving quality. Then, working on our patient portal, what do we do so it's butter smooth and people don't have to think about it? And then we develop technology on education. We have an online university where we write our own courses for our own staff. And, so we don't have to keep repeating every time you have new staff, just repeat the same thing over and over. We centralize it into a knowledge base. So it's really been a journey of addressing every aspect of an organization so it can be scalable.
So what were some of the pitfalls along the way as you're thinking about commercializing and scaling your business, and some of the lessons learned?
Yeah, I think the lessons learned was I don't think we understood early on, the knowledge you have in-house is not going to translate somewhere else unless you have a system in place, right? So if you're going to open up, 20 Old Navy stores, the headquarters gets it, but not all those 20 other locations. So the pitfall is you can't just assume that the staff in Memphis, Tennessee will have the same background and intensity as your talk about as the mothership does.
Right.
And so you have to write technology and educational stuff to address even a remote third, fourth, fifth, 10th location, so they get it, and provide them with the tools and things that are easily at their fingertips. So in other words, something that my staff at home would know just because they know it. You can't assume that, with a new staff in Tennessee. So,
well, going back to your McDonald's example, you can go to any McDonald's across the country and call it a burger, call it whatever you will. It's going to taste exactly the same, right? Because of the systems and processes that are built right in that model for there to be that consistency. And so it sounds like that's what you're talking about, is those systems and processes that allow you to scale and maintain quality while you're scaling.
Yeah, you hit the nail on the head. Yes. Can you produce the same pancake, waffle, burger, whatever it is, and it's going to taste the same, be the same, and literally nobody will know the difference if they walked into this location and this city and that location. So and I think people underestimate how much you can leverage technology to help you with that. And I think you asked me what our mistake was. I don't think we understood early on we tell, oh, this should, they'll figure it out, or we'll just, we'll send them, something will be on a computer somewhere, they'll read it. And no.
Yeah. Yeah.
No, you literally can't let them even do it. You gotta you gotta guide them. And when people talk, when I hear entrepreneurs in Silicon Valley talk about scalability, that's the ultimate definition of scalability. How much brain damage is it to scale staff and structure as you grow? And if there's a lot of brain damage, it's going to be very painful.
Yeah, no doubt. All you're doing is expanding and making your problems expand and spreading your problems across the country.
Right? Exactly. Right. Right.
So,
nobody ever said we got into trouble because we spend way too much time and effort into becoming scalable before we expanded. So often we expanded and realized, OMG.
Mm-hmm. Yeah. So as you're scaling, are you tied to a brick and mortar that in a specific geographical location that's kind of anchoring your growth strategy from market to market, or are you transitioning, or have you transitioned to more of a digital model that's not necessarily tethered to brick and mortar, especially
Great question.
Pandemic?
Great question. So the answer is yes and no. So with E7 Health as is, because you physically have to get a vaccine or a blood test or a urine test, you just can't get away from the brick and mortar for especially the parts that we have to do. However, we're just on the verge, probably in the next 2-3 months, of launching E7 National. And E7 National is a technology we've been working on for a long time. And that allows our clients to get about 50 to 75% of our services anywhere in the country. So they'll be able to use third-party labs and people we've contracted with using our technology, our software. So E7 National is about to go live, I would say, in the next few months.
Yeah.
And then what U.S. Drug Test Centers is simply that. It was one department in E7 Health, which is drug testing, which we have been doing now since 2016, which is a nationwide drug testing company. And what we did was we wrote a lot of technologies so we could manage everything we're doing without using third-party software. So we've actually, have brought that in-house to the point that we can allow other third-party administrators and drug testing companies to use our platform. So we've gone from being a drug testing company that uses a platform to also having a platform. Mm-hmm. So I would imagine in Q2, we're going to offer our platform to our competitors.
Okay.
In other words,
mm-hmm.
Because really no one else has done it. I mean, it's with duct tape, spit and glue, how most of these other companies and Excel spreadsheets and other stuff, how they manage their nationwide drug testing companies. And we don't have Excel spreadsheets. I mean, everything we do. And so we created the platform for us, but it's a cloud-based platform. And I think it's so blue market strategy kind of thing. If you know the book I'm referring to, it literally nobody has it really. And so we want to be the first to market. So not only will it help us grow as a drug testing company ourselves, because we'll be on this platform, but then the platform in itself is a business. So we're going to let our competitors, if they're up for it, have better technology.
I don't know any business that doesn't want to be a platform business when they grow up. Right. Yes. The valuation model is very different for a platform business. So I hear that very often. So as we kind of start to wrap up our conversation, thinking about the folks in our audience that are at different phases of scaling their business, what are some of those fundamentals that you would want to share with fellow innovators of, to be able to successfully scale, whether it
Mhm.
is service diversification, whether it is giving a larger national footprint, whatever that might look like, what would be some wisdom that you would want to share, having
Mhm.
had quite a bit of success in scaling
Mhm.
your innovation?
Yeah, I mean, to really be able to scale, you have to understand, you know, the future problems you're going to have when you scale, and you have to address them before you scale. A lot of people, I think, scale and then come up with the solution. I see this, a lot of times where, oh, we're opening up 20 more locations next year. Oh, because we just got this money. Okay, that's interesting.
Yeah.
You wonder why, I saw one of your thing about 95%, or you were saying 95% of things fail. I mean, part of it is you have nobody puts a gun to your head and says open 20 locations next year. You say it. Okay. Like, I mean, just you control it. So I think the temptation to raise money and move is often not good. And one way to keep you in check, one way to kind of keep you on your diet so you don't cheat, is really resist the temptation to raise money, okay, until as far as you can go. Bootstrap it all. Don't go into debt. I would say don't go into debt, and don't raise money until you really have to, because I think both those, that kind of easy money, you got to really think long and hard when it's your money, right? When you're bootstrapping it. But when you have access to your first round of whatever, and you use that money to boom, like, oh yeah, there's all this money in the bank now. Let's knock it out of the park. So I think the biggest lesson is scaling before you're ready. I
Mhm.
mean, like expanding before you're ready.
So how
Okay.
would someone know that they're ready to scale? What would be one of the two of those indicators?
Well, I mean, what I would do is, like, do a test scale and see how much brain damage it is.
Yeah.
I mean, that really will, don't open up 20, open up one,
Right.
just
Right.
one. Okay. Open up one and take a year and see how much it hurts. If it
Yeah.
doesn't hurt a lot, that means your systems and processes are good. If it keeps you up at night and you're like pulling your hair out, you
Don't do
need
that
more.
19 more times.
Yeah, yeah. Don't do that. Right, right. And learn from that one. Learn from that one. I mean, just do that once to say, okay, what do I need? What would I need it to have in place to make that go smoother?
Mm-hmm. Yeah, lots to think about. And it's a in my mind, the role of the CEO certainly shifts, that
Mhm.
the characteristics, the role, the skill set that a startup entrepreneur needs in the beginning to build something from nothing is very different than the skill
Mhm.
set that is needed to be able to scale that business. And sometimes the one person has all of those skills, or can acquire all of those skills over time, to be that same CEO that's growing with the growth of the business. And sometimes it's just very different. And there's also a transformation that needs to happen there. Mm-hmm.
I agree. You have to either get a new CEO, or you have to listen and grow
Yeah.
and evolve into those skill sets, because you're right. The skills 10 years ago, I was like interviewing people and in the trenches and doing educational stuff, and which is whatever. But over the years,
Yeah.
we took that and said, well, maybe our training could be more technology driven, and so
Mm.
we and my leadership can spend time on growth things and not just in the weeds. And so yeah, you definitely grow and your position changes.
Well, thank you so much for joining me today, and sharing your story with our audience. How do folks get a hold of you if they want to follow up with you after the show?
Yeah. So Well, my website, baktarimd.com. You can certainly contact me through there, on LinkedIn, and of course on YouTube. We have our podcast. So any of those days, or you can reach out to e7health.com, our website, or usdrugtestcenters.com. So any of those places, but me personally, probably Baktari MD and LinkedIn.
So I don't want to miss that opportunity. What's your podcast and how do people find that?
Yeah, so just literally it's called Baktari MD. That's the name of the show.
Yep.
On YouTube and on Apple and all the podcast streaming. So just put in Baktari, Baktari MD. And so it's the Baktari MD show. So it's easy to find.
Awesome. Thank you so much for joining me today.
Thank you so much. It was an honor. Thanks for having me.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.